Chinese virus. We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is. Completed, signing it in just a little while, right after I'm finished with this conference. I'll be signing it. It's prepared to go. So we will be invoking the Defense Production Act, in which activated FEMA's National Response Coordination Center. FEMA now is fully engaged at the highest levels. Today, FEMA is activated in every region. We are at level one being the highest level. Done a lot of work with FEMA. They're incredible. It's always been on hurricanes or tornadoes. They're right now in Tennessee. A large group working in Tennessee have been incredible. That was a tragic event. We're sending, upon request, the 2 hospital ships. They're being prepared right now. They're massive ships. They're the big white ships with the Red Cross on the sides. One is called the Mercy and the other is called the Comfort. And earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months. It used to take years to do this, and now we did it just in a very short while. The self-swab, a much easier process than the current process that's not very nice to do, I can tell you, because I did it. If it would test positive, the people would go, and every generation of Americans has been called to make shared sacrifices for the good of the nation. And now it's our time. We must sacrifice together because we are all in this together and we'll come through together.
And today, at the President's direction, FEMA has gone to level 1. People without symptoms should not get tested. We want to make sure that the supply of testing is there for those that need it most or are symptomatic or in the vulnerable population. Dr. Deborah Birx in a moment will address the progress that we're making on testing, the infection rate, our recommendations to every America, as well as some important new findings about the impact on youth that we're gaining. People without symptoms should not get tested. We want to make sure that the supply of testing is there for those that need it most or are symptomatic or in the vulnerable population. Dr. Deborah Birx in a moment will address the progress that we're making on testing, the infection rate, our recommendations to every America, as well as some important new findings about the impact on youth that we're gaining from data that's coming in.
So, we continue to look at data every single day. There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs. We think part of this may be that people heeded the early data coming out of China and coming out of South Korea that the elderly or those with pre-existing medical conditions were at particular risk. It may have been that the millennial generation, our largest generation, our future generation that will carry us through for the next multiple decades, there may be disproportional number of infections among that group. And so even if it's a rare occurrence, it may be seen more frequently in that group and be evident now.
In response to COVID-19, we have issued international and domestic travel restrictions to all DoD personnel and families that should dramatically reduce potential exposure to the virus.
Conserving personal protective equipment is also essential to combat the virus. So today, CMS will announce detailed recommendations to further promote this needed conservation, specifically by limiting non-essential elective medical and surgical procedures, including dental procedures. We believe that these recommendations will help surgeons, patients, and hospitals prioritize what is essential while leaving the ultimate decision in the hands of state and local health officials and those clinicians who have direct responsibility to their patients. But the shared sacrifice is essential to help those that are on the front lines.
Okay, why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China. I want to be accurate.
About Chinese
Yeah,
Americans
please,
in
John,
this country?
please.
The aides behind you. Are you
I
comfortable
have a
with
great,
this term?
I have great love for all of the people from our country, but as you know, China tried to say at one point, maybe they stopped now, that it was caused by American soldiers. And it did 128 countries, I think. It's in something like that, very close to that. Think of that. So it spreads violently. It's a very contagious, very, very contagious virus.
Do you consider America to be on a wartime footing in terms of fighting this virus?
I do. I actually do. I'm looking at it that way because, you know, if it got out of control, the big thing we did was a very early stoppage of people coming in who could be very, very heavily infected.
On the northern border, sir, when you say
Which border?
temporary, the northern border,
Yeah.
when you say temporary, which is what you said in your tweet, does that mean 30 days?
I would say 30 days, and hopefully at the end of 30 days, we'll be in great shape.
Let's talk about the tests, sir, for a second. If federal officials have shipped millions of tests, as you and your colleagues have said, why, as the federal government says, have only 59,000 tests been processed to this point? We just heard from the Atlanta public health director saying that they have fewer than 50 test kits for more than 900,000 citizens.
Yeah,
Where are
well,
the tests?
I'll let Mike answer that. Deborah.
So that's a very critical question, and thank you for asking it. So the test kits that we put out last week through the approval, the rapid movement of that meeting that President Trump called less than 2 weeks ago, that has resulted in bringing our private sector to the table because the test and the platform that was out there could only run between 4 and 12 tests per platform per day. We've now moved into platforms that can run basically tens of thousands of tests per day. The reason I talked about Thermo Fisher yesterday is because their platform is in 2,000 laboratories. They're the ones that are putting out the million tests this week that will solve the issue that Atlanta and others have brought up. I wanted to be clear. We prioritize the areas. We do county by county analyses. Based on those analyses, on what counties had more than 50 cases.
So I just wanted to clarify something because just a week ago, you all were standing here telling us that unless you had sustained contact with somebody who was symptomatic for COVID-19, you really didn't need to worry. You told the president, the vice president, that if they shook hands with somebody who had this, if they took a photograph with somebody who had this, they didn't really need to worry. And yet, several days later, we're in a situation where people are being told, don't leave your houses. There are curfews saying you cannot walk alone at night after a certain time. Can you walk us through what seems like a very dramatic swing, a very dramatic disconnect from what we were hearing before to what we're hearing now?
So 2 things. We look at data all the time, and I know you're looking at the China and South Korea data. I think none of us really understood the level of surface piece. So we're still working out how much is it by human-human transmission and how much is it by surface. And this is why those fundamental guidelines were put out that says don't expose yourself to surfaces outside the home. Expose yourself to surfaces that could have had the virus on it, for which on hard surfaces, I know we had the cardboard issue about shipping, hard surfaces, not shown in fabric as much or in cardboard, but hard surface transmission. These are issues that we haven't had to deal with before with the level of respiratory infections, and that's why we have this concern, and that's why the president put out the guidelines.
About millennials and others perhaps not taking some of these warnings as seriously as you would like.
They were feeling totally invincible, or are feeling that way, but they don't realize that they can be carrying lots of bad things home to grandmother and grandfather and even their parents. Say it.
Thank you, Mr. President. In talking about China, you've been very clear about who you think is to blame or where the origins of blame for this virus is.
Not think. No. I don't think. I know where it came from. I don't know if you'd say China's to blame. Certainly we didn't get an early run on it. It would have been helpful if we knew about it earlier.
There were a lot of Americans that were already alienated. We saw deaths of despair increasing through suicide and other things. Now, as these individuals, a lot of times in rural parts of the country, are self-isolating, what is your message to those individuals, and what do you hope that individuals, communities, and churches will do to reach out to
My
them?
message is to all Americans, but to those Americans who are going through a lot, we love them, we're with them, and we will not let them down. Thank you all very much.
Please don't tell the supervisor I have the flu. What the? The dreaded Osaka flu has hit Springfield with over 300 cases now reported. Okay, Mr. Sun, give me what you got. Sarge, we keep getting orders to let the virus win. Must be a school day. Lay down your arms. And now for an emergency announcement from the mayor.
People of Springfield, because of the epidemic, I have canceled my vacation to the Bahamas.
We need a cure! We need a cure!
Springfielders are advised to stay tuned for more information if they experience any of the following symptoms: mild thirst, occasional hunger, tiredness at night.
How's the ice cream, kids? Great! Who's ready for a kitten? I am. Make mine calico.
Here you go.
This whole morning has been wonderful. Too wonderful.
You're right. This is it. They're selling us to be crash test dummies.
Oh, please let it be Volvo.
Oh, you children are too suspicious.
It's go time.
It's shot day!
Welcome to hell, Mann Avenue Medical Plaza. Well, that just leaves Bart.
Don't forget Maggie.
Oh, I got her when your heads were turned. Got her good. Now, Bart, just look out the window. It'll take your mind off the pain.
See you later, inoculator.
He can run, but nobody escapes the needle. Darlene, cancel all my appointments.
But I need that kidney now.
One way or another, I'm gonna find you. I'm gonna get you one way or another. I'm gonna do you. Get you one way or another. I'm gonna see you. I wanna meet you.
You're just too smart for me, Bart.
What?
Huh?
Thanks, Barney. Mo, we won't need you now. Maybe this would be a good time to talk about side effects. The boy's hearing should clear up in a day. If it doesn't, call me in the Bahamas. For now, he can express himself with this complimentary pen.
Cool.
Oh, it's a good pen. Try it out. That was a malpractice waiver, fool.
Just hours after the coronavirus was designated as a global pandemic by the World Health Organization, Hollywood's all-time sweetheart Tom Hanks announced that he had tested positive for the virus while shooting a movie in Australia. On March 11th, Hanks posted on his Instagram that he and his wife Rita Wilson, who also tested positive, both felt cold-like symptoms, fatigue and body aches. He added, "What to do next? The medical officials have protocols that must be followed. We Hankses will be tested, observed, and isolated for as long as public health and safety requires." As not only the first high-profile celebrity to be diagnosed, the actor's son, Chet Hanks, tried his best to put fans at ease about his parents' health with a video on Instagram.
They both are fine. They're not even that sick. They're going through the necessary health precautions, obviously.
But what is it that made Hanks so prone to catching the spreading virus in the first place?
Hello, I'm Tom Hanks. The U.S. government has lost its credibility, so it's borrowing some of mine.
Tousle my hair, Mr. Hanks.
Sure thing, son. Now, I'm pleased to tell you all about the new Grand Canyon. Coming this weekend. It's east of Shelbyville and south of Capital City.
That's where Springfield is.
It's nowhere near where anything is or ever was. This is Tom Hanks saying if you're going to pick a government to trust, why not this one?
Did you see that? Yes, they're going to destroy Springfield.